I'm Dr. Kristen Hornung. Please call me Kristen. I have my master's in clinical mental health counseling, my doctorate in depth psychology with an emphasis in depth psychotherapy, and I'm licensed as a professional clinical counselor in the state of California, number 2071. I basically became a LPCC because in my own life experience, I ended up crossing paths with a therapist that helped me quite a bit, and my own journey of recovery inspired me to help others. My professional theoretical orientation is a little complicated. I practice EMDR, so I work on the adaptive information processing model, where I kind of consider the past, present, and future of a client when they're looking at any given problem that's brought them to therapy. And then I also work from a depth psychological lens, which means that I consider the role that the unconscious plays in someone's presentation and also look at healing from a more creative and comprehensive lens. So, for people who have different religious backgrounds or different spiritual preferences, I'm able to look at them from that perspective as well. Like if someone has a spiritual practice that's very important to them, the depth psychology training that I've had will better equip me to understand the role that it plays in their life. Because it's not just about thoughts and behavior, it also adds in that extra dimension to working with someone. In terms of what population I'm interested in working with, I primarily am interested in working with people who have experienced trauma or other negative life experiences, and maybe they need some support with managing stress, with communicating more effectively, coping with difficult emotions, help recognizing patterns at play in their life so that they can choose more effective behaviors. These are just some of the problems that interest me, and I do like to work with people also who need help with their self-esteem. Maybe they have some negative narratives that they're living out and they need some help figuring out how to change course and identify their strengths, their values, and look at how they can really build a life worth living. So I do use some dialectical behavior therapy, motivational interviewing, some CBT coping skills. I suppose you could call me eclectic. I do try to be very intentional, though, about what interventions I'm using so that I can explain it to the client. It's really important to me. I'm a very transparent therapist. I like people to be on board and really know what to expect and what to know, is what's happening. We come up with a treatment plan together and we collaborate on steps to take towards their goals. Let's see, I work with adolescents and adults. I have worked with older adults. I've worked with kids. I've kind of seen lots of people. I've been practicing since, 2011 when I was in my master's program. I've also been a clinical supervisor for both a children's youth and family program and then an adult program. I've also held a older adult position before, so a little bit of everything. Trainings or specialties, I have completed my basic training requirements with EMDR. I've done some advanced trainings with them as well. Other trainings, motivational interviewing, DBT skills training. Yeah, kind of a little bit of this, a little bit of that. There's a lot more information on my website, and I can provide more information on the trainings I've had. I like to learn more about therapy whenever I can. And then, yeah, that's it about me for now. If you would like to know more, please check out my website. I have some videos up there too. Thank you. Let me know any questions you have.